Hi, I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com, answering a patient question again today. This is one I receive very frequently. It's kind of difficult to answer with a one kind of sentence answer, but the latest one was from a gentleman, Rick from London, wrote to us on Facebook, wondering about what would be the most appropriate strain for PTSD, including which terpenes are most appropriate. Well, Rick, it doesn't surprise me that you have this question. PTSD is one of the most common diagnoses that I am certifying patients in the state of Arkansas for. In fact, nationwide, it's one of the top 5 qualifying conditions as far as patients seeking medical cannabis. Post-traumatic stress disorder, most people are familiar with it. There are specific criteria for it, though. This is according to the Diagnostic and Statistical Manual version 5 that my psychiatry colleagues come out with. It has to include a set of clusters of symptoms. One of them that has to be included is a stressor. That is a traumatic event that happened to the person, whether it's direct exposure to the trauma, they witnessed the trauma, perhaps they're a first responder such as a police officer, a fireman, a paramedic who witnesses trauma, or perhaps a family member has been involved in a traumatic event. The next set of symptoms that have to be included is what's referred to as an intrusion symptom. Now, this would be nightmares, flashbacks, really intense, distressing emotions, and physical reactions to these, such as increased heart rate, sweating, nervousness, fast respiratory rate. There also has to be included unpleasant changes to mood or thoughts, that is, decreased interest of things that normally do interest the patient, blaming themselves or others for the problems, difficulty in feeling positive, some depersonalization. Avoidance is very, very common in PTSD patients and has to be included in the criteria to meet the diagnosis. That's very often avoiding external reminders of what happened. For instance, one of my patients was involved in an automobile accident on a highway overpass. This gentleman went to the extreme of avoiding driving on the highways whenever possible. Changes in activity are another symptom that has to be present. That's either aggression or irritability. Hypervigilance and hyperawareness. Now, that's very, very common in PTSD patients. One of my veteran patients that was involved in the Middle East wars, trash day is very difficult for this gentleman. With the trash cans wheeled at the end of the driveways every Monday or Tuesday, whatever day it happens to be, it's a triggering event for this gentleman because those are very similar to where IEDs that were used in the Middle East against our soldiers were planted in. So that's a triggering event for him, and he is very hypervigilant over this. So generally speaking, most people are familiar with many of the symptoms of post-traumatic stress disorder or PTSD. When it comes to treating it with cannabis, I kind of view it as which of the symptoms we're treating at the time. Whether or not these symptoms are present or not in a particular patient determines whether we're going to use a specific cannabis therapy for them. The symptoms that we treat are the insomnia and nightmares. That's one segment that I treat with cannabinoids. The next are panic attacks that happen in patients very oftentimes with PTSD. And the third one is the baseline depression and anxiety symptoms, along with these triggering events that patients with PTSD experience during the day. All three of these are approached somewhat differently, and I'd like to go over each of them individually in separate videos that we will be producing here very shortly. For my PTSD patients, though, one thing I'm going to leave you with today is most patients with post-traumatic stress disorder that have been using cannabis have experienced a bit of paranoia and anxiety with certain cannabis strains. This is almost always related, I should say, to the presence of the terpene pinene. Pinene, if dominant in a particular strain, is notorious for eliciting panic attacks in PTSD patients. I usually advise all of my patients with post-traumatic stress disorder to avoid strains that are pinene dominant. Off the top of my head right now, that would be Gorilla Gum would be one to avoid. Typically Strawberry Cough, Apple Sherbet are several others that are typically high in pinene and should be avoided. So one of the reasons that detailed terpene analysis is very important for choosing the appropriate cannabis strains for most patients. I'll be covering the first aspect of PTSD treatment, which is nightmares and insomnia, on our next video. I hope you found this interesting and informative. I do want my post-traumatic stress disorder patients out there. If you're a medical cannabis patient, you can make very significant improvements in the quality of your life using medical cannabis. As always, proper strain selection and cannabinoid ratios are most important. You can find more about this on our website, CannabisExpertMD.com, CannabisExpertMD on Instagram, Facebook, and Twitter, and on YouTube, all under one word. Dr. Brian Nickel, your cannabis expert. Looking forward to seeing you soon.